In the summer of 1929, a 24-year-old doctor in a small German hospital pushed a rubber tube into a vein in his own arm. Then he kept feeding it inward. 10 centimeters, 20, 40. The tube passed his shoulder and entered the great vein behind his chest. At roughly 65 centimeters, its tip reached the right side of his beating heart. Werner Forssmann was awake the whole time. There was no surgical team standing by, no heart monitor, and no established human procedure telling him where the catheter might go. He walked to the X-ray room with the tube still hanging from his arm. The image he made there is unsettling even now. Ribs, the pale shape of the heart, and one narrow white line ending inside it. That line eventually led to the modern cardiac catheter laboratory. It gave doctors a route for measuring pressure inside the heart, mapping electrical signals, injecting contrast, opening blocked vessels, replacing valves, and treating defects without opening the chest. Millions of people have traveled some version of that route, but the familiar version of this story is too clean. It turns Forssmann into a lone rebel, makes every superior a fool, and jumps straight from one dangerous afternoon to a Nobel Prize. The real history is stranger. His experiment mattered. Other people made it medicine, and the man who took that risk later made political choices that cannot be edited out of the frame. Your heart is not simply a pump sitting still in the chest. It is a moving set of chambers, valves, electrical pathways, pressures, and currents. For most of medical history, doctors could listen from outside. They could feel a pulse, press an ear or stethoscope to the chest, and infer what was happening behind bone and muscle. The living interior remained closed. A catheter changes the problem. Put a flexible tube into a vein in the arm or groin, and the bloodstream provides a path. Venous blood flows back toward the right atrium. A carefully guided catheter can follow that same route. Once it arrives, it can sample blood, measure pressure, deliver contrast, carry a sensor, or guide another instrument. That is why the modern cath lab looks less like an operating theater from 1929 and more like a room built around navigation. Fluoroscopic X-rays show the catheter moving. Pressure traces rise and fall with each heartbeat. Contrast turns invisible vessels into branching black rivers. A wire crosses a narrowed artery. A balloon opens, a stent remains behind. Forssmann did not invent those later tools. He did not create coronary angioplasty, the stent, electrophysiology, or catheter valve replacement. His contribution was more basic, and in its own way, more audacious. He demonstrated that a tube could enter the living human heart through a peripheral vein, and that the heart would keep beating. The idea did not come from nowhere. Before Forssmann touched his own arm, physiologists had been putting tubes into animal hearts for nearly 2 centuries. In 1727, the English clergyman Stephen Hales inserted a glass tube into a horse's artery and watched blood climb through it. More than a century later, French physiologists threaded instruments through the vessels of living animals to measure pressure inside the heart. By the 1920s, textbooks could show a catheter reaching a horse's heart. The path existed in animals. The argument was whether anyone should try it in a person. Forssmann had just finished medical school when he arrived at the August Victoria Clinic in Eberswalde. He imagined a catheter as a safer way to deliver medicine directly to the heart. At the time, an injection into the heart usually meant a needle pushed through the chest wall. A tube approaching through a vein might avoid that blind puncture. His chief refused permission. That decision was not absurd. A catheter could tear a vessel, introduce infection, trigger a clot, or disturb the heartbeat. Forssmann had no modern guide wire, no continuous imaging, no sterile disposable kit, and no evidence from human trials. He was proposing an experiment on a living person with consequences nobody could confidently predict. So Forssmann changed the subject of the experiment. He chose himself. Later accounts add a great deal of theater to what happened next. Some describe a nurse deceived or restrained. Some turn the trip to radiology into a chase through the hospital. The details shift depending on who tells the story. The secure facts are dramatic enough. Forssmann used local anesthetic, opened a vein near his elbow, advanced a ureteric catheter toward his heart, and arranged an X-ray to prove where it had gone. Imagine the procedure without the legend. The catheter enters a vein at the inside of the elbow. It moves through the upper arm toward the shoulder, then into larger veins behind the collarbone. From there, it follows the superior vena cava down toward the right atrium. Forssmann could not see the full path while he advanced it. He worked by anatomy, distance, and feel. The tube did not need to pierce the heart. blood vessels already formed a continuous route into it. That was the insight he wanted the radiograph to make undeniable. At the X-ray department, the catheter appeared as a pale line running across the chest. Its tip lay in the right atrium. Forssmann had advanced it about 65 centimeters. He had performed the first published, radiographically documented catheterization of a human heart. He published the result in November 1929. The paper was short. The image did much of the arguing. Here was a living person with a tube inside the heart and no immediate catastrophe. Yet one successful self-experiment could not answer the questions medicine actually needed answered. Could the procedure be repeated safely? Could pressure readings be trusted? Would a catheter left in place cause infection or clotting? Could sick patients tolerate it? What did measurements from inside the heart mean? Forssmann tried related contrast experiments, but he did not build the clinical research program that could settle those questions. Criticism hardened around him. He moved into surgery and urology. For more than a decade, his white line on the X-ray remained less a medical highway than an abandoned track. Then researchers in New York found it. At Bellevue Hospital, André Cournand, Dickinson Richards, Hilmert Ranges, and their colleagues were studying how blood and oxygen moved through damaged hearts and lungs. Indirect measurements could only take them so far. Forssmann's old paper suggested a way inside. They proceeded differently. Instead of one spectacular act, they built a method. They tested materials. They measured blood gases. They compared pressure curves. They learned how long a catheter could remain in place and how to interpret what it recorded. In 1941, Cournand and Ranges reported cardiac catheterization as a clinical method. The difference matters. Forssmann proved that the route was possible. Cournand and Richards made the route reproducible and useful. Modern medicine needed both kinds of work: the person willing to test a forbidden idea, and the teams willing to spend years turning an image into reliable evidence. Once the method became dependable, the interior of the heart began to speak in numbers. Pressure in the right atrium, pressure in the ventricle, oxygen content in different chambers. A sudden step in oxygen could reveal blood crossing through a hole where it should not. Contrast could outline vessels and chambers that had previously been guessed from shadows. Later clinicians carried thinner wires into coronary arteries, inflated balloons, placed stents, burned faulty electrical pathways, and delivered replacement valves. None of those procedures belongs to one inventor. They form a relay across generations. Forssmann eventually received credit for starting that relay. Before the Nobel ceremony, however, Germany and Forssmann had passed through a history that heroic retellings often leave out. In 1932, Forssmann joined the Nazi Party. He also joined the SA and the Nazi Doctors Association. This was before Hitler took power in January 1933. The timing matters because it rules out the comforting claim that membership was simply forced on him after the regime had complete control. Historians still debate his motives and the full extent of his political activity. The documented memberships are not in doubt. During the Second World War, he served as a German military medical officer. After the war, he was barred from medical practice for a period, and a denazification process classified him as a follower. This does not make the catheter vanish from the X-ray. It also does not allow the catheter to erase the choice he made in 1932. Scientific biography often tries to sort people into two neat boxes: genius or fraud, hero or villain. Forssmann resists that comfort. The young doctor showed physical courage and scientific imagination. The same man joined organizations serving a murderous political movement. Courage in one room does not guarantee judgment in another. There is another reason to include this chapter. German medicine did not stand outside Nazism. Physicians joined the party at unusually high rates, and medical institutions helped enforce racial policy, exclusion, coercive experimentation, sterilization, and murder. Forssmann's story belongs inside that professional history, not in a sealed corridor leading only from Eberswalde to Stockholm. After the war, he worked with his physician wife and later returned to urology and surgery. Meanwhile, cardiac catheterization was becoming indispensable. The discovery had acquired a life larger than its originator. In 1956, the Nobel Committee divided the medicine prize among Werner Forssmann, André Cournand, and Dickinson Richards. The wording was careful: discoveries concerning heart catheterization and pathological changes in the circulatory system. The prize recognized an experiment, but also the long clinical program that made the experiment useful. Forssmann was 52. 27 years had passed since the tube entered his arm. By then, doctors could use catheters to measure the failing heart, study shock, examine congenital defects, and map the circulation between heart and lungs. The abandoned track had become a working road. Today, a catheter can enter through a puncture small enough to cover with a bandage. It can show a blocked artery and open it in the same session. It can close a hole in a child's heart, replace a valve in an older patient, or trace the electrical loop causing a dangerous rhythm. The patient may go home without the long incision that once made heart treatment almost unimaginable. The first image still deserves its power. A young doctor stands beside an X-ray with a line running into his own heart, but the completed board has more on it than that single act. It includes the animal physiologists who found the path, the chief who saw real danger, the New York teams who made measurement reliable, the patients who accepted early procedures, and the later clinicians who built modern treatment. It also includes the party card from 1932. Forssmann's life leaves us with an awkward fact. A person can be brave without being wise in every part of life. A discovery can save people even when its discoverer made choices we should condemn. History becomes more useful when we stop asking it to provide spotless heroes and start asking what exactly each person did. One tube proved that the living heart was reachable. Thousands of people turned that proof into medicine. If you want more stories where one strange experiment changes what doctors can do, subscribe and tell me which medical risk you want on the board next.